Hi, I'm State Representative Ross Hunter. I'm proud to represent the 48th Legislative District, which is parts of Bellevue, Redmond, and Kirkland, and all of the Points communities, Medina, Hunts Point, Yarra Point, and Clyde Hill. I have the great honor and privilege of being the chair of the Budget Committee in the House. And one of the big jobs that we have to do this year is do our state's integration with the Federal Affordable Care Act, what you might have heard about as Obamacare. It's a fascinating opportunity for us this year. We have the opportunity to cover hundreds of thousands of people in this state at federal expense. And unlike most things that happen at the federal level, this one's actually paid for. The federal government raised taxes on everybody, so we're paying the taxes to provide this service to people in Washington, whether we do it or not. And if we don't do it, our money will go to support other states that do. So this gives us an opportunity to cover really, literally, somewhere between 300,000 and 400,000 additional people who are below what we would say is 138% of the federal poverty level. And that works out to be about $25,000 per household if you had about 3 people in your house. The poverty level differs a little bit depending on how big your household is. This is a large fraction of the people who are remaining to be covered, people who don't have insurance in Washington today. So we think we'll cover somewhere 300,000 or 400,000 there, another 300,000 or 400,000 in the exchanges version, where the federal government will provide subsidies for people to buy insurance through what is called the healthcare exchange. You could sort of think about this as the Expedia for healthcare, or the Amazon for healthcare, depending on what you buy online. It's an opportunity to compare plans, one against the other, and to make a decision based on what's right for you and your family, but with federal help so that it will be less than 3 or 4% of your income to cover the monthly premiums. And that's a pretty good deal for people. So that gets us up to somewhere between 700,000 and 800,000 people, and there are only about 1 million people who are uncovered in Washington. So almost everyone will be covered, which will take a lot of the costs out of the hospitals who have to cover care for the indigent today. That money that they save will appear in savings in your healthcare bills, because right now they shift all of that cost onto private healthcare insurance. One of the more interesting things about how this works out in Washington state is that the counties that are helped most by this are not the ones you think. It's not King County that'll be most helped. It's counties in the rural part of the state where we have much higher incidence of poverty. So by covering people out in rural Washington through this act, we'll be able to provide more uniform health care coverage throughout the state. Now, this sounds like it's going to cost us a lot of money, 300,000, 400,000 people now added to the Medicaid rolls. But because of how our healthcare system works today, and because of federal reimbursement rules, the federal government is going to pick up the tab for all of the newly eligible people. We're going to save about $200 million, cover 300,000 or 400,000 more people in the next 2 years. I think it's a pretty good deal for people in the state of Washington, and we have pretty broad support here in the legislature. And this is not just partisan support. We have support in both parties and in both the House and the Senate. I think we'll get this done, and I think that we'll get it done early so that it's off the table as a decision point before we get the budget done. As always, if you have any questions, you're welcome to call our office. You can look at my website for further information. That's www.rosshunter.info. Or you can send me email here at the legislature at ross.hunter@leg.wa.gov. Thanks for your time.